Welcome back. In this audio lecture, we're going to be learning about alterations in ventilation. And so, again, this is something that affects the ability of air to get to the respiratory exchange process or exchange surface. And so now we're not talking about damage to the alveoli. Okay, we're talking about damage to the conduction pathway. And so in this lecture, we're going to be focusing on cystic fibrosis. Cystic fibrosis is a autosomal recessive disorder. It occurs on autosomal genes, specifically on chromosome number 7. And the acronym stands for Cystic Fibrosis Transepithelial Conductance Regulator. Okay. And what this channel is responsible for is transport of chloride into and out of the cell. Right. So in this image over here, we have a CFTR protein, and so the CFTR protein allows chloride, to get out of the cell, right? And so the movement of sodium and chloride out of the cell creates an osmotic draw that pulls water into the surroundings. So you notice in this image over here in a normal lung, we have water filtering up, diluting the mucus, okay, or working on the secretions from the pathway. So we're getting some secretion of water here. And what happens is during cystic fibrosis is we get a defect in this channel, CFTR, and so we get a defect in the channel, and so we actually can no longer transport chloride as functionally, right? And so if we don't move this chloride, we can't produce this water. We can't move water into this passage here. And so what happens is we get a thick mucus. These cilia no longer work, and so this generally affects mucous membranes, but it can also affect sweat glands. Okay, so it mostly affects the lungs and the pancreas, which both have mucous membranes. Anything with a mucous membrane is going to be relatively affected. We know that individuals with cystic fibrosis have a relatively short lifespan. Okay. And so this lifespan is due to the problems that are associated with the inability to transport chloride. So this chloride, and if you prevent the movement of water, let's say in the lungs here, will prevent exchange, right? So we might be unable to exchange gases as efficiently between our respiratory surfaces. This is going to be in a bronchi, but we get the buildup of bacteria and in the mucus. And so remember that the mucus, this is not the first time we've seen this. This mucus can serve as a hotbed for bacterial growth, like we saw in rhinosinusitis. And so this buildup of mucus in turn builds up the mucus in our alveoli. Okay? And so this can have nutrient effects too, and that it will block absorption of nutrients from our digestive tract if this mucous membrane gets too thick. Okay? So the cilia cannot function properly because the mucus is too thick to actually move, and so the cilia don't propel the mucus out of the lungs. And so we're going to talk about treatments later, and this part of one of the treatments is helping this mucus get out of the lungs. So who does this affect? Primarily Caucasians, but it can affect Latinos and indigenous Americans. And so this is always present at birth. We know it right away. So there's 1,000 new cases diagnosed yearly, but there's 10 million carriers. So remember that it's more common to be a carrier for a recessive disorder than it is to be affected, because all right, so here's the progression of cystic fibrosis. Cystic fibrosis, again, is an autosomal recessive disorder, so which makes it kind of rare in frequency, because you have to then find another recessive individual to have a child with. Okay, and so you might be a carrier and not even know it, right? So it's important for people who have cystic fibrosis in their family to undergo genetic counseling to look at their chances of having this condition. So cystic fibrosis affects really anything where movement of chloride is affected. And we see that this is going to be exocrine glands. And so exocrine glands, remember, release substances onto a surface of an organ. Yeah. And so we're going to focus on right here first and foremost, so focusing on visceral organs, and then we'll move over to sweat glands. And so the result is excessive amounts of thick, sticky mucus obstructing these excretory glands. So this is a problem. So in the lungs, this production of the mucus, which is supposed to be protective because it's supposed to trap bacteria, prevent it from building up in the lungs, gets stuck in the lungs because now it's so thick, because it can't be diluted by the water, because now chloride cannot move out of the cell and have water follow it. So this mucus gets really sticky, and then it starts blocking airways. And so if you remember from that last slide, when we looked at really how this forms, is we had a bunch of bacteria growing inside of the mucus. When we have bacteria growing in the mucus, this allows for potentially frequent bacterial infections, and then that can lead to fibrosis of the lung, and then you get cor pulmonale, which is essentially so it's ventricular effects of the right ventricle. So it's going to be structural changes, and maybe right ventricular hypertrophy. This could potentially lead to right side heart failure. We also see it affect the digestive tract. So the digestive tract, if it has the inability to move water into the digestive tract and dilute this mucus a little bit. Remember, one of the treatments for a lot of these conditions with mucus was liquefying the mucus, right? So increasing hydration or humidifying the air that we're breathing. So what we have here is we have a really thick mucus, okay? And we see multiple effects. So if we see it in the newborn, which we do see cystic fibrosis in the newborn, we get this condition called meconium ileus, which is intestinal blockage due to increased stickiness of fecal matter building up essentially in the newborn. And so this occurs actually in the small intestine. And so as it builds up from the large intestine, because we can't move it back any further, we can't move it forward, it starts to build up in the system. Okay. And this can lead to an obstruction, right? So the buildup of fecal matter, impaction. And so meconium is newborn fecal matter, but it's really sticky, and so what we see here is this is really sticky mucus because we coat fecal matter as it moves through the digestive tract in mucus to help it lubricate it, but it's generally not terribly sticky. Now, if this mucus isn't getting water because we're inhibiting chloride transport, then the fecal matter gets really sticky. We could also see obstruction of pancreatic ducts, so pancreatic juice, enzymes, and so if these enzymes are blocked that are released into the small intestine in the duodenum, because that's excretory gland is a mucous membrane, we could end up getting fibrosis, and then if we cause damage, we could ultimately cause diabetes mellitus. In the liver over here, we see that the bile ducts can become blocked with this mucus as well, and this leads to biliary cirrhosis. And so this biliary cirrhosis will cause liver damage, and if we have this altered ability to secrete bile, we have altered ability to process fats and absorb fats from our diet. So we find that in adults, oftentimes we find fecal matter has a high concentration of fats. Now ultimately, these conditions could lead to decreased absorption of nutrients, right? So if you are unable to secrete the enzymes like amylase, released from pancreatic amylase or bile, then you're going to get decreased absorption of those nutrients because we need them to break down to be able to absorb them. For reproductive function, so this is a pretty wide-reaching disease because it affects mucous membranes. And so for mucous membranes, we see that it can affect reproductive tract by blocking some essential pathways. So in males, we could get blockage of the vas deferens, and if the sperm can't move through the vas deferens, we get infertility. It says sterility is a manifestation in your textbook. I couldn't find any. Sterility indicates that you no longer produce sperm, right, or eggs. This is an infertility issue, not a sterility issue. And so when we block that passageway, we can't get any sperm out during ejaculation. Okay, the same way goes for the females, okay, and that we could block cervical entry. So the cervical mucus can block sperm entry in the female reproductive tract, even if sperm are produced in the male. Now, in sweat glands, this didn't make a lot of sense to me, and I had to go to the internet to find the answer. So for the sweat glands, we actually get sweat released not through chloride channels, but through exocytosis and from increased capillary exchange. And so we find chloride in the salt, and then normally we uptake chloride. We reclaim chloride from our salt, and so if we have a disruption in this protein, then the CFTR protein, then we can't reclaim that chloride, and so our skin is the salt that gets deposited on our skin is actually going to have a higher salt concentration. Okay, and so that is one of the manifestations of having sweaty skin or salty skin, and so you have this salty skin because you can't absorb enough chloride, or reclaim enough chloride, because you have a defect in the CFTR channels. This can lead to electrolyte balance and dehydration, obviously, if you can't reclaim those chloride ions. So complications with cystic fibrosis. Okay. This atelectasis, this is a collapse of the lung, essentially. You could get recurrent infections, and if you cause fibrosis of the lung, you could end up changing vasculature and then having effects on the heart and causing structural defects on the right side of the heart. Again, here is the image showing the mucus, okay, and the bacteria can accumulate in here, and the cilia don't work because they're being weighed down by this mucus. It's too sticky. Okay, we could have respiratory failure because we're no longer able to move this mucus out of our lungs. Again, we could have malabsorption of nutrients, hence because we block pancreatic secretions and liver secretions like bile. We see that we could suffer from malnutrition because of this, because we're unable to get essential things in our diet. Okay. So electrolyte imbalances are because the sweat pores are altered. Sterility is not really in effect here, but infertility is, because we could block a movement of those the gametes through the reproductive tract, especially in males, and in females we could prevent their movement up into the fallopian tubes where fertilization needs to occur. So how is cystic fibrosis going to manifest itself? Salty skin, meconium ileus, steratoria. So remember that meconium ileus is talking about a really thick mucousy fecal matter in infants, and so this is going to be a really strong indicator. Steratoria is too much fat in your fecal matter, and then fat-soluble vitamin deficiency. So if you can't absorb the fats, then it's very difficult to absorb the vitamins that are associated with their fats, because oftentimes they move along with the fats through the chylomicrons and so on. Now we could have a chronic cough because we have mucus buildup inside of our pulmonary structures. We could suffer from hypoxia and fatigue, so the hypoxia could lead to fatigue. But for each organ that it affects, you should be able to associate these manifestations with those various organ functions. You might suffer from activity intolerance, which would be due to the fatigue. Audible rhonchi would be due to the mucus in the respiratory system. And then delayed growth and development would be because of multiple factors. First of all, you have this nutrient absorption disorder, and you aren't able to extract enough oxygen from our environment. So we see multiple manifestations of this, right? And so we need to be able to associate all these things with the condition itself. And these manifestations are easy to explain and associate with the disorder. So I would be able to do all that. How are you going to diagnose cystic fibrosis? Sweat and stool analysis. So if your sweat is really salty, if it has a high chloride content, this would be an indicator. Stool analysis would indicate a high level of lipids in that stool, and probably a high level of mucus as well, more so than normal. Chest x-rays, so we're going to look for the conduction passageways, and we're going to look for how those appear on the X-ray. We're going to be doing pulmonary function tests, so looking at spirometry, okay, and the inflow and outflow of air, and the volumes to make sure that we're able to move those well. Arterial blood gases, so we might expect arterial ABG to express a low oxygenation and a high carbon dioxide. And the book didn't list this one, but I decided to list it: genetic testing. So if your parents are both recessive carriers of cystic fibrosis, then you likely you have a pretty good chance. You have 50% chance of getting the cystic fibrosis. So in treatment, there's no cure to cystic fibrosis. We're going to treat the manifestations. So we're going to replace the pancreatic enzymes like pancreatic amylase, bicarbonate, to facilitate the breakdown. Okay. Some proteases. We're going to replace the bile salts because now the liver, we can't get those from the liver, and so that's going to enhance lipid absorption. Okay. And to go with that, we're also going to try to absorb more, deliver more fat-soluble vitamins along with these replacements of organ functions. We're going to change the diet, so switch to a higher protein because most of those enzymes are located in the small intestine along the brush border. Okay. We want to reduce the fat so that we have to supplement our diet a little bit less. Okay. We're going to increase fluid intake to liquefy the secretions, and then undergo intensive chest physiotherapy, which I've shown in another lecture. This involves tapping the back and cusping your hands and slapping the back, and it's kind of a violent thing to hear and watch, but do yourself a favor, Google chest physiotherapy, and this would allow you to get an idea of what these individuals have to go through on a weekly basis. Okay, they have to loosen up that mucus to get it out of their system. Now, that chest physiotherapy is only going to alter the pulmonary manifestations, not the other manifestations, the other organ functions. Okay. Some other treatment mechanisms: we could have postural drainage, so changing your posture to mobilize the secretions, and so I have you laying down for a little bit and changing those directions. Coughing exercises, which would be similar to deep breathing exercises in an effort to mobilize the secretions, the mucus in your lower respiratory tract. Okay. We're going to use humidified air to liquefy the secretions, and this would go with hydration. And then bronchodilators. So now we're going to, since we have this mucus buildup, we're likely experiencing some inflammatory events as well. And so the bronchodilators are going to aid in reducing your bronchial inflammation. Regular moderate exercise, so just to keep on getting your body in an effort to move the mucus out by itself. And then you really want to look out for bacterial infections and treating those bacterial infections fairly early. Oxygen therapy, you might have to do a heart and or lung transplant. Okay, so oxygen therapy would increase atmospheric oxygen, increase the concentration gradient between your circulation and the atmospheric air. And then a heart and lung transplant, obviously this would result after you are experiencing cor pulmonale. And so this is talking about changes to the heart and then the lungs. If they're so damaged and fibrotic from the presence of the mucus, then you would want to do a lung transplant as well. So that concludes the audio lecture over cystic fibrosis. I hope it was informative, and I hope you got some more information about how dangerous cystic fibrosis can really be and how rare of a disorder it is. With that said, I'll see you next time.